Today we will know everything about PCOS and PCOD, what it is, what are the causes, what can you do to combat the symptoms of PCOS and PCOD. We are going to talk about every aspect of today's topic, that is PCOS and PCOD. Hello and welcome back. I'm Adria. I'm a yoga instructor, certified nutrition and lifestyle coach. Welcome to Yoga Fit with Ed and Ross. First, we will understand what is PCOS or PCOD. PCOS is a common endocrine disorder affecting girls and women of reproductive age, characterized by a combination of symptoms due to hormonal imbalance, excess androgens, enlarged ovaries, multiple cysts on ovaries, experiencing irregular menstrual cycle, hormonal imbalance leading to acne, hair growth and weight gain. PCOD is considered less severe by some, generally referred to multiple presence of cysts in ovaries. Now we will understand why some of the women or girls from the age of 12 or 13 go through the toughest time of their life, struggling to overcome polycystic ovary syndrome and polycystic ovary disease. What are the causes of PCOS or PCOD is multifactorial, involving a combination of genetic, hormonal, metabolic and environmental factors. These factors interact in complex ways to disrupt normal ovarian function and lead to symptoms associated with conditions. Understanding these underlying causes helps in tailoring effective treatment and management strategies for individuals affected by PCOS or PCOD. Let's learn them in detail. Women with a family history of PCOS or PCOD are more likely to develop the condition. Specific genetic variations may increase susceptibility to hormonal imbalances. Elevated levels of male hormones, androgens, can disrupt normal ovarian function, leading to irregular menstrual cycles, ovulation problems, symptoms like acne. Insulin resistance, where the body's cells do not respond effectively to insulin, is common in PCOS. High insulin levels can stimulate the ovaries to produce more androgens, worsening symptoms. Many women with PCOS have insulin resistance, which means their bodies produce more insulin to maintain normal blood sugar levels. High insulin levels can contribute to increased androgen production by ovaries. Elevated insulin levels can lead to weight gain, which further exacerbates insulin resistance and hormonal imbalances. Women with PCOS have higher levels of inflammatory markers. Chronic inflammation may contribute to insulin resistance and ovarian dysfunction. Environmental factors, lifestyle, poor diet, lack of physical activity and stress can exacerbate the symptoms and contribute to development of PCOS and PCOD. Growing up, I had a friend who was going through the symptoms of PCOD, and her mother used to see the doctor for treatment all the time, but nothing worked. As I get this now and can relate, because growing up in a chronic stressed environment, she had a biased, critical parent who never missed a chance to criticize her looks or her behavior. Her mom used to get her to the doctor for checkups regularly, thinking that she is doing her duty, but the stress that her daughter, my friend, was going through mentally was not letting her fight the PCOS symptoms. Until date, she is going through the symptoms because she criticizes herself now, looking into the mirror and finds herself unworthy for multiple things. So I would remind our parents out there to take care of their child mentally, and who knows, they may overcome every physical wound in them. Exposure to endocrine disruptors, chemicals that interfere with hormone functions such as certain plastics, pesticides and industrial chemicals may play a role in the development of PCOS. Strong smell of wall paints, industrial oil or strong perfume, deodorant, makeup, serums, etc. Abnormal follicle development, ovarian dysfunction. In PCOS, the ovaries may develop numerous small cysts, fluid-filled sacs that results from follicles that fail to mature and release eggs properly. This can disrupt normal menstrual cycles and ovulation. The HPO axis regulates the release of hormones that control the menstrual cycle. Dysfunction in this axis can lead to irregular or absent ovulation and menstrual cycle. Obesity and weight gain. Obesity can exacerbate insulin resistance and hormonal imbalance. However, it is important to note that PCOS can occur in women of all body types, not just those who are overweight. Hypothyroidism and hyperthyroidism can affect menstrual cycle and may coexist with PCOS. Conditions affecting the adrenal glands can also lead to excess androgen production. How can you take control and manage the symptoms? So when it comes to managing polycystic ovary syndrome or polycystic ovary disease, certain foods can exacerbate their impact on blood sugar levels, inflammation and hormone balance. Foods that should be avoided at any cost: refined carbohydrates and sugars, sugary snacks and drinks such as candies, cookies, cakes, pastries, soda, sweetened beverages, energy drinks. All these types or kind of food and beverages play a crucial role in increasing the chances of making the PCOS and PCOD symptoms worse. Processed foods such as fast food, packaged snacks like chips, crackers and instant noodles, again made with palm oil, refined carbs and lots of preservatives, which again is extremely harmful. Not only one suffering from PCOS and PCOD, but also for someone who is not going through the symptoms may face certain hormonal imbalance in their body, which may later result into some other health issues. Refined grains such as white bread, white rice, pasta made from refined flour, maida, breakfast cereals with added sugars, inflammatory foods or any type of sugar substitutes, which you should be absolutely making yourself aware of. The earlier the better. I have made a video related to what sugar does to your body and also named more than 60 sugar substitutes that are equally or more harmful than sugar in your body. So I would suggest to go watch the video and keep yourself updated. Trans fats like fried foods, margarine, baked goods made with hydrogenated oil, processed meats such as sausages, hot dogs, bacon and other cured meats, high glycemic index foods such as starchy vegetables that are potatoes, especially when prepared as fries, or chips, fruits high in sugar like watermelon, pineapple and overripe bananas. In moderation is fine. Focus on low GI fruits. Dairy and gluten. Women with PCOS may find reducing dairy highly beneficial. This includes milk, cheese, cottage cheese, yogurt and ice cream. Many women with PCOS report improvements in symptoms when reducing or the best eliminating gluten totally from their diet. This includes food made from wheat, barley, rye. Instead, go for millets such as pearl millet, also known as bajra, sorghum, also known as jawar, finger millet, also known as ragi, one of my favorite. High sodium foods, salty snacks like potato chips, pretzels, salted nuts. Instead, go for unsalted nuts, homemade protein bars. I have a recipe on this channel. Do check out. Make your life easy. I'll link them below. Processed and canned foods such as canned soups, frozen meals and other food high in sodium, artificial sweeteners such as sucralose, saccharin, stevia found in diet sodas, and sugar-free products which will double the risk of overall health issues. Food additives and preservatives such as monosodium glutamate, MSG, nitrates and other chemical preservatives, alcohol and caffeine, especially in larger quantities as it can affect blood sugar levels and hormone balance. Excessive caffeine can interfere with hormone levels and stress responses. Limit intake to moderate amounts or totally exclude them. Include whole grains, legumes, non-starchy vegetables and lean proteins. Increase fiber intake. Foods high in fiber can help manage insulin levels. Include fruits, vegetables, legumes and whole grains. Incorporate healthy fats. Choose sources of healthy fats like avocados, nuts, seeds and olive oil. Opt for lean proteins. Chicken, fish, tofu, beans and lentils are good choices. Stay hydrated, drink plenty of water and avoid sugary drinks. Adapting your diet to manage PCOS symptoms can make significant difference. How polycystic ovary syndrome can be managed naturally through lifestyle changes like regular exercise. Aim for at least 30 minutes of moderate exercise most days of the week. Incorporate both cardiovascular and strength training exercises. Stress management, practice yoga. Do check out yoga videos for PCOS. I have linked in description. Practice them every day along with meditation techniques like Tai Chi can help manage stress and improve overall well-being and mindfulness. Engage in activities you enjoy to help reduce stress. Ensure 7 to 8 hours of quality sleep every night. Maintain a regular sleep schedule. Focus on whole foods like fruits, vegetables, lean proteins and whole grains. Avoid processed foods, refined sugars and high glycemic index foods. Include sources of healthy fats like avocados, nuts, seeds seeds and olive oil. Omega-3 fatty acids found in fish like salmon and flax seeds can be beneficial. Incorporate foods with anti-inflammatory properties like berries, leafy greens, turmeric and ginger. Ensure sufficient protein intake from sources like lean meats, eggs, beans and legumes. Drinking spearmint tea twice a day may help reduce androgen levels and improve symptoms. Cinnamon can help regulate menstrual cycles and improve insulin sensitivity. Acupuncture may help regulate menstrual cycles and improve ovulation. Here I have come to the end of this video. I hope it was useful and quite informative for you and has brought some awareness in your life. Hit thumbs up if you like this. It goes a long way in supporting this channel. Subscribe and share it to all and spread awareness. Keep improving every day and I'll see you soon.